Hello and welcome. If you're joining us live, welcome now. If you're joining us later, welcome to the replay. This is Dr. Sarah Merritt, and this is a fun broadcast because you have Dr. Sarah and Dr. Sarah. My guest today is Dr. Sarah Stombaugh, who is an obesity medicine physician in Charlottesville, Virginia. Dr. Stombaugh works with patients to help with controlling their weight. And in fact, she has a podcast. Tell us the name of your podcast, Dr. Stombaugh.
Yes, it is the Conquer Your Weight podcast.
The Conquer Your Weight podcast. And we're going to talk with her a little bit today about some of her perspective as an obesity medicine physician. Again, I'm Sarah Merritt. My practice is called Lifestream Health Center. We're in Bowie, Maryland. We're helping make pain management more caring, accessible, patient-centric, and evidence-based. If you're looking for pain management in Central Maryland, please come see us. We serve all kinds of patients and are hoping to help patients live life better. Part of what I'm doing is enjoying some conversations with friends like Dr. Sarah Stombaugh and sharing some of the perspectives that we have as physicians to help patients. For me, as a pain management doctor, so much of what we do is helping patients learn to manage symptoms and live life better. And some of that can involve controlling one's weight or just improving one's diet without an eye to weight, depending on the patient's needs. And so I think Dr. Stombaugh is here, and I'd love to hear her perspective as an obesity medicine doctor. There are so many big topics in obesity medicine, and I have many patients that I would say come to me and are interested in weight loss. Dr. Stombaugh, that's why patients tend to seek you out? Tell us a little bit about what you do.
Yeah, absolutely. My background is in primary care. I'm a family medicine physician by training, and I was doing that for 6 years and started to incorporate weight loss as part of my practice. You can imagine a lot of people coming in had questions about how to be best supported in their weight loss, or that weight was maybe central to some of the other health issues that they were dealing with.
Yeah.
And so it was through that I started supporting my patients and became board certified in obesity medicine. And over the last 3 years, I've really been focused exclusively in this weight loss space. I have a private practice, as you mentioned, in Charlottesville, Virginia. And people come to me because they're looking for weight loss. And that, of course, is really the underpinning of my work with them. But my goal with working with patients is to help them really reconnect with their bodies and learn what it is that their body needs, what it is their body is asking for, and how do we lean into that in order to support certainly our weight goals, but more importantly, just our overall health goals as well. And so that ends up hitting all of these different pieces, whether it's chronic pain, whether it's other chronic illnesses that someone may have. How do we utilize that when we think about diet, we think about movement and sleep and stress management and all of these things? When we think about having our best health and leading our best lives, it really requires attention to all of those different areas. And so starting to bring attention to those that for a lot of people, we've really neglected for a long period of time.
That's so interesting. Yeah, and I think what does that even mean to reconnect to your body? I think that's super interesting. I would just share candidly, I have started doing reformer Pilates, and it's something that as an exercise, right, really forces you to engage the core. I feel it's helped with a new connection with my own body and my own life. But I'm super interested because I do feel like a lot of there is data, in fact, not just I feel like, but there is data that for patients in pain, that many times there are multiple treatments that involve getting into your body, so to speak, that might include whether it's exercise or breathing or different things to connect differently with your body. So in your practice, what does that mean to you, or how do you talk about that with patients? How do you help patients reconnect or connect or reconnect with their body?
Yeah, absolutely. So there's a lot of different facets. There's, as you can imagine, a lot of emphasis on diet, and our the standard American diet is not the healthiest. We have a diet that is filled with refined carbohydrates, refined oils, things that do not drive our best health, whether that is just pain, whether that is weight. It can be really challenging to eat the standard American diet, which I love. The abbreviation for the standard American diet is the SAD diet. And I think that's really the most appropriate way to describe our diet. But paying attention to what are the foods that we eat and how are those fueling our bodies. And so I have all my patients do a food log, and they're paying attention to, as they're thinking about their different proteins and their different fats and different carbohydrates and the types of foods that those are, how often are they eating, what is their hunger, what is their satiety, and paying attention to what foods have staying power, what foods help them feel energetic hours later versus foods that have them feeling really maybe ravenous a couple of hours later, feeling that kind of crashy low blood sugar feeling.
Mhm.
Paying attention to what are the foods, if they have a symptom, if they have migraines, if they have fibromyalgia, if they have IBS, for example, and they have certain foods that may be flaring up their symptoms. A lot
Mhm.
of times people know, okay, there may be some triggers here, but they haven't really been able to tease those out. And so as we're paying attention to the foods that we're consuming, for example, starting to put in, okay, I mean, I just note when I have a headache or a day where I'm feeling more achy, are there things here that, oh, wow, every time I'm having more dairy products or having more processed carbohydrates, for example, that I'm
Mhm.
noticing that some of these things flare up. And it's really interesting because we call it a food log, but it ends up being sort of the everything log. And people
Yeah.
will start putting in how they're sleeping, how they're moving their bodies. Do they feel more energetic during a workout? What are, if you're doing exercise, for example, what are the foods that you're fueling maybe before an exercise or in the hour or two afterwards to make sure you're
Mhm.
supporting building your muscle mass? And really just paying attention to what does my body need and asking for right now? Because a lot of
Mhm.
times we are completely disconnected from that. And so this reconnection, it's sort of built slowly over time. And
Mhm.
I love helping patients to explore that.
Yeah, that's so interesting. And so it sounds like part of the food log might not just be what I ate, which I've kept that kind of food log before. Here's what I ate. And it
Mhm.
starts to feel a little tedious. So I can imagine that if you're logging maybe some symptoms or positives or negatives or even an emotion, is that something you might have people log? I wonder that it might help connect better and be useful in a different way.
Well, that's exactly it. And I think finding the value in it, right? So
Mhm.
sometimes we tell people to do things and they sort of do them begrudgingly and they
Yeah.
might stick with it for days or weeks. And finally they're like, what's the point? This isn't doing
Mhm.
anything for
Sure. What is
me.
he doing? Mhm.
And so, what is it that someone needs? What would be the goal of having this log? Is it going to
Mhm.
support them in their weight goals, in their pain goals, in something else? And as they're paying attention to some of those factors and starting to draw conclusions, they start seeing the value in it. And so they really do. There's more buy in when you see that there is
Mhm.
an immediate feedback, or at least some feedback that you're
Mhm.
getting from doing this.
Do you have any value, or do you see any value in an elimination diet? Is that something that you work with patients on, or that might be a second stage after someone's kept a log for a time and noticed a trend?
Yeah, so it's common that people actually will do, I would say, like a self-imposed limitation diet where there's
Mhm.
or elimination diet where they are noticing, oh, isn't it interesting every time I'm eating bread products, for example, that I'm feeling really
Mhm.
bloated and feeling kind of bleh afterwards. And so even sometimes subconsciously, they'll start to
Mhm.
eliminate those foods from their diet. And so then when it does come up, which is now maybe a more rare thing, they're like, oh, I felt terrible yesterday. Why was that? And they start to see that happening. And so most commonly, actually, it happens in a very unconscious or subconscious way for my patients. But there are some times that it's a more guided, let's do a trial without this food or that food and see what role it is or isn't playing in your body.
Interesting. And so a patient keeps a log. They might notice some trends, try adding or subtracting food from the diet. Um, what are the other steps, or how else might a patient approach weight loss in your practice?
Yeah, absolutely. So we are often layering on a couple of different things. So we're thinking
Mhm.
about the food aspect, we're thinking about the movement. And so paying attention to what are the movements that we enjoy, both psychologically and then physically, what are our bodies capable of doing? Are we giving ourselves grace for the stage that we're at right now? A lot of
Yeah.
patients were athletes when they were much younger, and they sometimes feel this really big disconnect because they're not necessarily at this stage right now. And so,
Right.
what is it that our bodies are capable of doing? Do we know how to do that on our own, or do we need to ask for support and guidance in that? How are we balancing? I have a lot of conversations about resistance training because there's this really important part of making sure that we're supporting our muscle mass, especially during a weight loss journey. But
Yes.
honestly, for anyone, when we think about exercise, sort of that cardio aspect, thinking of things that are getting our heart rate moving, getting our lungs breathing, it's really important from a longevity standpoint. And then what are the things that are providing resistance for us so that we support our muscle mass, support our bone mass? And both of those things are important when we think about what does movement look like. But it's other stuff too, right? Thinking about sleep, thinking about stress management. A
Mhm.
lot of times, so many people are not sleeping well enough. A lot of people may
Gosh,
sleep, whether
yeah.
it's quality, whether it's quantity, they're just not getting enough of sleep. And so, starting to build some of these habits in their other arenas as well.
Mhm.
It's amazing where it's small, but all of these changes start to build on top of one another. And then we start noticing that really, regardless of our weight, sometimes our bodies just feel better. We feel stronger. We
Right.
feel more energized. We feel good.
Yeah. I think that's really interesting too, because you're right. Many times those lifestyle changes can be really impactful with or without significant weight loss, right? And
Hmm.
while certainly probably patients who are looking to work with you may have a weight loss goal in mind, like some of it's not just about the scale, I'm sure.
Well, and we focus on that a lot of what are the non-scale victories that we see. And when you think about the way that your body is functioning for you, is it functioning for you in the way that you want it to? And
Yeah.
sometimes even before we see movement on the scale, and sometimes especially if we're not seeing movement on the scale, if we're thinking about someone who has a really significant increased body fat percentage and they've been doing a lot of exercise type work, working on resistance training, they may really see a shift in their body in terms of a smaller waist circumference, their clothes are fitting differently. The
Mhm.
scale movement may not be significant. And so
Right.
they're like, oh my gosh, I'm not losing weight, but my waist is 3 inches smaller.
Oh boy.
And that sometimes really happens, right? Because we have
Yeah.
made the shift of decreasing our fat mass and increasing our muscle mass. And
Mhm.
so, and that feels good. Our bodies feel strong and they feel like they're functioning in the way that we want them to.
And so in addition to, it sounds like changes in food, encouraging changes in movement, and I like what you said earlier about giving yourself grace for the stage that you're in. I
Mhm.
guess to maybe expand on that, one of the challenges that I have in my practice is patients who legitimately have a significant amount of pain and are
Mhm.
either anxious about moving more or feel they can't move more at all. A lot of times I'll discuss that, hey, the body is kind of a use it or lose it thing. And so we need to work with you to get you as active as possible, whatever that looks like for you. And for many of my patients, I might say, make a contrast and like, look, you don't need to run a marathon, right? That's not what we're talking about. But like, let's
Mhm.
just, you know, see what the next thing that you can do without causing a ton more pain. And as we work this the safe zone, that safe zone of the things you can do can get bigger. Um,
Mhm.
and that's kind of how I tend to talk about it with patients, sometimes with a referral to physical therapy. In your practice, how do you help patients get moving when they may have legitimate challenges around moving and or fear around movement or exercise? How do you work with people to get through all of that?
Mhm. So as you said, it's a very personalized thing because
Mhm.
everyone will have their own challenges and struggles that may create certain limitations. And so it's exploring what are sort of the definitive limitations. So if you have a broken leg, like you cannot walk on
Right.
that leg, for example, versus are you having like an intermittent pain that's flaring up or an arthritis that
Mhm.
is going to do fine in some circumstances, but may not do as well in other situations. And
Mhm.
so, really stepping back to look at are there movements that you've done in the past that have felt really good for your body? Or what are the things that you really enjoy doing? And so, a lot of times, even like when we talk about the food logging and saying, hey, we'll sort of stick with it for a while, but, after a while, if you're not seeing the benefit of it, you're just going to give it up. The same thing's true with exercise. I think a lot of
Mhm.
people are willing to start a program and they might do it for a couple of weeks. But if it doesn't have any sort of benefit for them, either they're seeing the benefit of it, they're enjoying it, they're going to stop it. And so thinking about what are some of those underlying motivational factors, I think are really probably the most important. What does it do for us? Do you feel like you got a breath of fresh air, literally, because you went outside? Do you feel like you got a pause in your day? Do you feel like your body is just feeling, worked through some of those aches and pains, if depending on the type of stuff that you're dealing with? So looking at, do we have access to warm water therapy pools? Is it
Mhm.
lower body, upper body that you're struggling with? Can we focus on one part of the body instead of the other? Are there things that are going
Mhm.
to be less impactful? And so you have a lot of knee arthritis, for example, and not able to do any sort of pounding activity. Are we doing swimming? Are we doing elliptical, bike? What are the
Mhm.
things that you can do that will support you without creating more issues? And
Yeah.
then I often refer to therapy, and one of our local gyms has a pretty cool program too, where it's sort of pseudo therapy, where it's
Mhm.
a monitored exercise program. And so
Nice.
that you're able to start and get access to the machines, see how to use them, and
Mhm.
sort of slowly, gradually build that over time. Because it often starts with we don't feel comfortable doing a lot of things. We may be lifting 1 and 2 pound weights, and that's
Sure.
okay, right? You
That's
have to
okay.
start
Mhm.
somewhere, and
Yeah.
you're never going to lift the 10 pound or the 20 pound or the 100 pound or whatever your goal is unless
Mhm.
you've started somewhere. And so
Yeah.
seeing that and really paying attention to the motivation aspect, I find to be the most important.
That's interesting. And for the monitored exercise type program, is this something that are patients paying out of pocket for that? Is that something that an insurance covers?
Yeah, so it's something that is covered typically by like an HSA or FSA plan. So
Okay.
it would meet that.
Mhm.
And then for patients who don't have access to those, maybe out of pocket. But our
Mhm.
program locally is actually about $99 for 2 months, and so it's really
Yeah, pretty
pretty
affordable.
accessible for most people.
That's exciting. Yeah, that's
Mhm.
nice. Um, Before we got on, we were also relating a little bit about working with patients who are interested in incorporating anti-inflammatory elements to their diet. So
Mhm.
often, there's a lot of talk in the lay press about an anti-inflammatory diet. How does that look in your practice, and is that something that you recommend?
Yeah, absolutely. So, right, we love this phrase. Inflammation, I feel like, has been a very hot topic over the last 5 to 10 years.
Yeah.
And an anti inflammatory diet, if you Google it, you'll have all sorts of different things come up. But we're looking at foods that are really supporting our body and its health. So, a lot of times, an anti inflammatory diet will be really whole food emphasis heavy. And so, lots of fruits, lots of vegetables, lean meats, whole grains. So, grains in their whole forms, like quinoa or farro, or truly like a bud of grain rather than like a whole grain bread, for example, often is just still a
Mhm.
very processed food item.
Yeah.
Thinking about
And
making
whole food
sure.
a whole
Yeah,
food generally didn't come out of a package, is that right? That's
exactly. Yeah,
one
so when
way
you
I
think
think about it.
about.
Is that correct? Yeah.
Exactly. Yeah. So grocery shopping, sort of the perimeter of the grocery store, would your grandmother know what this food is always a really good test. And so, I think about some of the things in our pantry, even like goldfish crackers. I'm like, my grandmother would not know what goldfish crackers were.
Mhm.
And so, is this sort of a real food that was from the earth, is another way to describe
Mhm.
it. So, is there something that came from the earth, food in its wholest form? So, fruits, vegetables, whole
Mhm.
grains. If you're eating animal products, that you're choosing animal products that are high quality, so ones that
Mhm.
are organic or grass fed, making sure that you're getting plenty of fats. The low fat
Mhm.
diet era of the 90s and early 2000s
Yeah.
really made a pretty big, created a lot of issues because we stopped eating fats in sometimes ways that were really pretty valuable for our body. We know that fats play a very important role in our health, and whether that's just in terms of satiety or whether it's in terms of our hormones that our body is building. So, making sure we're getting plenty of fats, especially from plant sources. So, things like avocados, things like
Mhm.
olives. Fishes are a really excellent source, especially seeds and nuts, also are great sources
Mhm.
of those. And then thinking about any of that processed stuff. So, really limiting sugars, limiting refined grains. So, things like breads, pastries, pastas, sugar and sweetened beverages. So, a lot of the beverages that we find on the shelves that have sweetener in them, whether it's true fish
Mhm.
sweetener or an artificial sweetener. So, an anti inflammatory diet is really this sort of whole food plant based diet, with certainly some emphasis in meat if you're choosing high quality meats. If I had to give it a name of another diet that we would talk about it, a Mediterranean diet is probably the most
Okay.
closely related to an anti-inflammatory diet. And a lot of times when I'm thinking about food logging with my patients, we're paying attention to and noticing, okay, isn't it interesting that eating lots of refined flours or grains, for example, are creating a flare up of fibromyalgia, which we'll sometimes see. And these type of things, a lot of times when we're eating sort of real food that came from the earth, food that is a plant, food that is a animal, and very unprocessed foods, we're finding that our bodies tend to do really well with those, and they create both weight loss. They can be really helpful from a weight loss standpoint, and really just many of our other health goals in general, and can be
Mhm.
helpful even in the reducing pain.
Very cool. Yeah, I think certainly to your point about the standard American diet being sort of sad, being something that is not very consistent with long-term wellness for our human bodies. Do you find that in working with patients to implement different dietary choices with an emphasis on whole foods, have you observed, changes in people's pain over time when you've done this work?
Yeah, absolutely. And whether it's short term or even then long term as they're losing weight, we can find that, certainly both of those things have benefits. And, I guess we haven't even said what is the role of weight loss in pain management. And that
Yeah,
in and of itself can be really significant. When we think
yeah,
about having chronic excess weight onto our joints, that is challenging, especially if you think about anything in our back or anything in our lower body, it's bearing your body weight all day long. And so when you
yeah,
think about pains in our feet, in our knees, in our hips, throughout our back, when we have chronic excess weight, that's an additional load to carry around. And a lot of times I like to think about just carrying an extra weight around. Our bodies are not made of
literally
dumbbells.
an extra
Yeah. And
20.
so,
30. Mhm.
exactly. So picking up a dumbbell does not often it doesn't necessarily make the connection for us. So one thing I'll tell people to do, so either if they have pets, particularly dogs, is, or if not, to go to the grocery store or the pet store and pick up a 20-pound bag of food or a 50-pound of dog
Mhm.
food. And
Yeah,
that very closely mimics what that amount of weight would feel like on our body. And so you
yeah,
can imagine that if you're carrying around 20 pounds, 50 pounds, 100 pounds, whatever that amount of excess weight is that over time, that's really a heavy load to be carrying. And so,
wear and
in
tear.
some ways,
Mhm.
right, exactly. And so,
Mhm.
if you imagine carrying that around sort of day in and day out in everything you do, getting on and off the toilet, climbing up the stairs, not even exercising, just our normal daily activities, that's really hard work for our bodies. And so, a lot of times, even just in losing 10% of our body weight, we can find, someone weighs 200 pounds, 10% of their body weight is 20 pounds. And a 20-pound weight loss is a meaningful amount of weight loss. And all of a
Mhm.
sudden, when they're going to the bathroom and getting in the shower and climbing up the stairs, that's
Yeah.
20 less pounds that they're moving. And so we start to see, even if someone hasn't achieved their goal weight, whatever their goal weight is, a lot of times at 5, 10, 15% weight loss goals, we really start to see huge improvements in chronic pain because there's just simply less weight being carried around.
Yeah, that's right. Yeah, I think that's a really interesting point too, because right, it's not like the goal isn't necessarily that we all need to look like bikini models, but if we can drop a little of that excess BMI,
Mhm.
there are even some survival advantages maybe to having a BMI around 25. Is that
Right.
what you're familiar with also that
Mhm.
so a super low BMI, 18, 20 or something that might be associated with, a great skinny body is not necessarily a survival advantage or anything that anyone needs to do for health reasons unless they just want to
Mhm.
do it. But I think getting from that BMI of 40 down toward whatever else, just that 20-pound weight loss, less wear and tear can be so impactful. We've
Mhm.
definitely seen that in our practice. I think the other thing we see is that patients, or excuse me, in terms of the statistics, right? That I think there are some statistics that the average American can maybe even gain a pound a year. That's like
Mhm.
pretty normal. time course for weight. So over 10 years, if you're not paying close attention, it's not hard at all, given the standard American diet and the lifestyle many of us lead, to put on 10 pounds.
Easily. Yeah. And we see a lot of times, 2 or 3 pounds over the holiday season,
Hmm.
that just slowly adds up. And I think 10 pounds, while that happens, I think it's frequently even much more than that.
Yeah. Yeah. So I think kind of that 10, 20 pound weight loss, just something can be really helpful. The other thing I'll tend to talk about with my patients also is that, fat itself is inflammatory, and usually,
Mhm.
it sounds like the way that you work with your patients also an emphasis on maintaining muscle. And if you're moving more and eating well, there would be some fat loss. Do you monitor that in your practice? Actually, do you do like those body composition analysis? Is that part of what you do to monitor if the patient's losing fat or losing muscle?
Yeah, so that is something that we do in the practice. But even if you're not doing a body composition, sometimes a simple waist circumference can be a
Okay.
really nice way to have a proxy. So for someone who's listening at home and they're like, well, I don't have access to a body composition machine, just measuring your waist circumference can give us a really good idea about our body fat percentage, and
Mhm.
especially visceral fat, which when we carry fat in our central section, so around, it's visceral because it's around our organs, of course, you know
Mhm.
that, but we think about that central adiposity. And when we have increased weight around our abdomen, that puts us at a higher risk of heart disease, of insulin resistant conditions like prediabetes or diabetes. And so that has a lot more significant consequences for us. And so waist circumference is probably one of the best proxies for body fat percentage.
Mhm.
And we talk about weight, but the reality is it's more about body fat. And so if we're thinking
Right.
about what is the best definition of obesity, or what are the people who are going to struggle the most with health consequences from their weight, it is people for whom they have an increased body fat percentage. And so
Mhm.
BMI, the body mass index, it's just height and weight, right? There's nothing fancy that goes into calculating our body
Yeah.
mass index. And so it's a really good screening tool on a population level. But when we start looking at the individual, thinking about our body fat is going
Mhm.
to be a much better correlation when we think about what are the
Mhm.
health risks that we have, what are the things that are going to best improve our health. And so that body fat analysis, whether it's a formal way or whether it's just an informal, like I said, waist
Mhm.
circumference measurement, that can give us some really good information.
Yeah, no, that makes a ton of sense, because I know for a fact, you know, people's frames are different. Some other
Mhm.
person, two people of the same height that have different frame, different body structure. I can imagine that you could have a more healthy and a less healthy situation depending
Mhm.
on how much body fat each
Well,
person.
yeah, and you even think if you've heard the phrase like skinny fat, for example,
Mhm,
a
mhm.
lot of people may have a normal BMI. So society may not look at them and say, oh, that person has obesity, or that,
Right.
person doesn't have to worry about their weight, but they may have a really significant body fat percentage. And they may have really pretty low muscle mass. And so when we think about both the health outcomes of that and then things like chronic pain, even that skinny fat person, not to
Yeah.
use that phrase, but that's what we talk about,
Yeah.
right?
Okay.
Is someone who has that higher body fat percentage doesn't have enough
Mhm.
muscle mass, even they may see the health consequences of that elevated body fat percentage, even though their body to someone on the outside doesn't necessarily look like it may be having
Hmm.
any issues. And so whether that's chronic pain, whether that's risk of diabetes or heart disease or all these things, working to support reduction of our body fat percentage and improvement of our muscle mass can have really big health improvements.
That's great. The other, as I'm thinking about the intersection of chronic pain and weight loss, the other place that we see it being impactful would be patients who might need a joint replacement.
Mhm.
Because joint replacements can be very effective treatments for end stage osteoarthritis, patients with severe osteoarthritis of hips and knees. These are things that are very normal with aging and can be accelerated by a history of injury. And in my practice, we certainly do injections to help with these conditions, but ultimately, there are patients who need more than an injection and may need a joint replacement.
Mhm.
And so we refer patients to see orthopedics for that. But it certainly happens that there are times that, depending on the orthopedic surgeon, depending on their practice and whether or not they work with high-risk patients, for a patient with a BMI higher than maybe 40, it might not be possible for them to get a certain joint replacement. I can certainly relate a situation of a patient that I had who very much needed a hip replacement, and his mobility was just severely impacted. And he went from being a reasonably active person to a quite inactive person while he was waiting for his hip replacement. And one of the issues was, getting this weight where it needed to be for the. Frankly, it's the safety of the operation. There are more complications over higher BMI. So, how do you work with those patients, or are there ways that you can work with those patients?
Yeah, absolutely. So I actually have quite a few patients in my practice who that's exactly the condition, the situation that they're in. Their orthopedic surgeon has said, really the BMI of 40 threshold is pretty common cutoff. And so a lot of times patients are advised to bring their BMI less than that. And a lot of the orthopedic surgeons that I work with too, like, hey, our goal isn't to get you to 39.9. A lot of times our goal is we can, but someone who has a BMI of 37 may do better than someone who has a BMI of 39. And so depending on how someone's doing in their weight loss goals, we may support them in bringing their BMI even to a slightly lower place, and they may be at further decreased risk of complications from that surgery. And so there's a lot of things we might do for a person who's in that situation. I think one, thinking about what are the foods that we're eating? How are those supporting our goals? A lot of times, while the movement piece is so important, a lot of times we can lose weight without as much of a component of exercise. It's not necessarily ideal because that, especially resistance training part, is so valuable in making sure that our bodies are maintaining our muscle mass. However, if we're really cognizant about the type of foods that we're eating, making sure that there's a good emphasis on protein, as we're losing weight, we may be able to do some, be able to maintain that muscle mass if it's primarily done from dietary intervention alone. And that can be very effective in that a lot of times patients are able to do some types of exercise. And so even if it's really pretty limited compared to what their favorite activities are, compared to what they were used to doing even a couple of years ago, we can often have some type of movements that they're doing either on their own or in the context of therapy, for example. And so that's something that I'll often have patients doing. But really that the dietary component, we may be using medications to support their weight loss goals if they have an indication for them. And more importantly, if they have insurance coverage for them, that's certainly something we run into at times. But supporting patients, and then really, we think about the metabolic state that we're in, and we know there's really good data to say that patients who are actively in a catabolic state, so actively really depleted, losing weight, that they may have higher risk in the perioperative state, so around and after surgery, compared to someone who is either stable or in an anabolic state we're building. And so a lot of times we're supporting patients in losing weight and then sort of finding a stabilizing place, making sure that they're eating really, I would say, nutrient dense foods. So foods that are protein heavy, foods that are fiber and vitamin heavy, things like vegetables especially, so that really stabilizing their body is going to support them to heal the best from surgery as well, not just being sort of as low as a weight as possible, but having this really stable place is important.
Yeah, going in really nourished sounds really good.
Yes, nourished, I think, is the best way to describe it.
Yeah. Right. And have we even had a conversation with a weight loss doctor if we don't talk about semaglutide or some of the
Let's do it. Yeah.
medications? So I haven't prescribed any of these medications. I think they are super big game changers though. And it's exciting. It's an exciting time in the weight loss field and to see patients being successful. One of my patients that I see for migraines, and we do some injections for migraine in the practice, and she's been on Wegovy, and she came in and she was like, yeah, I'm the incredible shrinking woman. She's lost 50 or more pounds, and she's really pleased with where she's gotten to be. Tell me about your experience working with these medications and the changes you've seen for patients.
Yeah, absolutely. So when we look at weight loss medications, it's a huge category of medications, but it's really been in the last decade, and especially in the last 2 to 5 years that we've seen the approval of medications like Wegovy, which is semaglutide, or Zepbound, which is tirzepatide. And those medications have really been game changers. So these medications are primarily targeting the GLP receptor, although the Zepbound medication is actually targeting a second receptor, the GIP receptor.
Okay.
And it's really pretty cool because the GLP receptor we have in a lot of locations throughout our body, and it helps to work on things like our insulin resistance, like some of the movement through our GI system. It helps slow down movement throughout the GI system so that we have satiety for longer. It helps to work in the brain. So people describe it as food chatter, and we have much less of that. And these medications work in all of these different ways. And I see them as a really phenomenal tool in the toolbox by which, when we are adding it with appropriate nutrition changes and with movement and all of these other components, they can really create a situation where people who've been trying to lose weight for a long period of time, sort of doing all of the right things, but hasn't found that it's effective, these medications have been a major game changer for patients who are in that situation. And so it's not a great tool for someone who isn't open to making dietary changes. We really need to be cognizant. We talked about that muscle mass component. As we're losing weight, we need to make sure that we're eating the right foods, doing the right movements that are going to support not just losing weight, but losing our body fat mass so that we are supporting our muscle mass. But for patients who are doing all this stuff, I mean, I've had patients who've lost 50% of their total body weight, which is just really unbelievable. And you can imagine how that can be life-changing in many different ways. And so I think, one of the biggest conversations is there a risk about people, is it cheating? Is it wrong to be doing these medications? And my answer to that is absolutely not. We know that for patients who have these chronic insulin resistance issues, they can be really phenomenal. And so anyone who is wondering, am I a good candidate for these medications? I would encourage them to have a conversation with their physician about that.
Awesome. I think I've been impressed with what I've seen, and that's amazing to hear. As much as 50% weight loss.
I should say that's not the norm. The averages are 15 to 20%, but there's going to be a variety. There's people who have less, and then there's people who have quite a bit more.
Right. Yeah, and I think that's right. I've certainly also heard of people that right. It's just that helps them with that last 20, 30 pounds if they've had a big goal to get through to, and that number can really help them get to the finish line, or a medication. Are these medications that once a person takes them, I mean, I guess I've heard different things. Is, in your opinion or in your experience, is this a medication that a patient might have to take forever once they use it? I'm not sure.
Yeah, so they are designed for long-term use, and I'm deciding if I should draw you a picture here, but I'll save you and your audience. But when we look at studies of discontinuing these medications and what happens, and we have a lot more studies that are actually ongoing right now. So I think over the next 5 to 10 years, we'll have really good data about what this looks like. But there are people who are able to maintain their weight even coming off of the medications. But there are people who see significant or even entire regain of the amount of weight that they've lost. And so it really ends up being a really individualized decision and discussion about what that looks like. So each of these medications has 5 or 6 doses available. And so we start at a low dose, and we slowly move up as we need to support patients in their goals, whether we hit the maximum dose or not. And then what we do is that if they're hitting their goal weight, we may start bringing that dose back down and see how they're feeling on a lower dose, if they're maintaining it. And so I have had patients who've come off of these medications. It's common that people may come down onto a lower dose, but I would say they should be considered as a long-term medication. And if someone's getting off of them, it's great that that's the case. But I also, that awareness that it is designed for long-term use, no different than if you were taking a cholesterol medication or a blood pressure medication. We prescribe these medications to support our body in the long term.
Makes so much sense. Well, Dr. Sarah Stombaugh, it's been an absolute pleasure. Thank you for that update. Please check out Dr. Sarah Stombaugh and her podcast, the Conquer Your Weight podcast. We can find it on Apple and Spotify and everywhere else. Is that right?
All the good places. Yes. Thank you so much for having me, Dr. Merritt. This was really fun.
My pleasure. Okay. Very good. And thank you, audience. Thanks for joining us live or on the replay. Come find us at Lifestream Health Center. We're in Bowie, Maryland. making patients, helping patients live life better, making pain management more caring, accessible, patient-centric, and evidence-based. Thank you, and we'll see you next time.